Don't you hate it when your dentist overwhelms you with all the treatment options you have for replacing a missing tooth? Hi, welcome back. I'm Dr. Langston. I'm the owner of Dental Implant and Aesthetic Specialists located here in Atlanta. I've been practicing since 2005. I'd like to walk you through a couple different options that you have for replacing missing teeth in your mouth. Make sure you listen to the end, because at the end I'm going to give you my number one most important thing to consider for a successful treatment plan to replace that missing tooth. So when you're missing teeth, I like to boil it down to four basic options that you have for a solution for replacing those missing teeth. The first option, while it's usually the best option, is to simply do nothing. A lot of times when we have our wisdom teeth taken out, there's no reason to replace those. If we're missing a tooth and the other teeth have shifted and everything's in the right place, again, no reason to replace them. While that is a solution, generally it's not the best solution because it can lead to a variety of problems. The first is shifting and crowding of your teeth. The body is very efficient, and when you have space in there, the mouth wants to move teeth and shift down, so that can include top teeth erupting down, bottom teeth shifting, and it creates issues in the mouth. Not to mention, missing teeth is not aesthetic. Now, it's cute in a 10-year-old, but if you're trying to walk around as a 30-year-old or a 50-year-old, people are going to notice, and a lot of times we need to replace that missing tooth. Another aspect of missing teeth is decreased chewing function. Even though you may think it's just a back tooth and nobody can see it, if you're missing that back tooth for long enough, you end up chewing on the other side of the mouth, which causes that side to start breaking down quicker. And so what originally didn't seem like a big deal, all of a sudden becomes a complicated process that could have been remedied if you had fixed that missing tooth in the first place. The second treatment option you have is basically a removable appliance. This is something that we make in the lab that replaces your missing teeth. It's something that you take out at night and you put it in the morning. Once it's in, it's comfortable, it's passive, it allows you to chew, it allows you to function, it allows you to smile, and it gives the appearance that all your missing teeth are there and in place. One major advantage of removable appliances is it's the least expensive treatment option. Another big advantage is we can get to the final product quicker. Now, it does take multiple appointments and lots of measuring and lots of details, but there's not a lot of downtime in between the start of the process to giving you your final appliance. The big advantage also is that you can take them out and you can clean them. So instead of having to brush and reach hard to get areas and open wide, you take the appliance out, you can clean them in your hand. We do tell our patients with all removable appliances, you need to take them out at night and not sleep in them. So when it comes to removable appliances, for a long time, the tried and true method was a cast metal framework which had metal clasps. It was great, it was sturdy, and it was very comfortable. The downside of that is the metal clasps are sometimes unaesthetic. Technology has got to the point where we can replace those with tooth color clasps, but those are prone to breaking as well. So one of the newer technologies that I'm really excited about is called a flexible partial. And basically it's a nylon resin hybrid that's flexible and moves with your mouth. So when you put it in, the heat of your mouth keeps it kind of pliable, so it kind of snuggles in. There's no metal lines, there's no unsightly areas that don't look like natural tooth and tissue. The third solution is a fixed solution, which is basically dental bridges. So when you have a missing tooth and you have teeth on either side of that gap, if they're broken down, if they would benefit by having a crown or some kind of protective restoration, a bridge is wonderful because it kind of kills two birds with one stone. Not only can we protect the adjacent teeth and improve their appearance, but you replace that missing tooth. So the process is very straightforward. Essentially, after getting you nice and numb, we prepare down those adjacent teeth, and then we make an impression, which is the mouthful of goo or a digital scan, depending on where it is in the mouth. Send everything off to the lab, and I'll make you a nice temporary bridge that you can wear while you're healing and waiting for the final bridge. So the final bridge comes in, it's permanently cemented and attached to those teeth. So once it's all the way in the mouth, it will look and feel like three teeth. Now, bridges are a wonderful option because we can not only correct the aesthetics of the adjacent teeth, but we can also protect those teeth. And bridges can span from a couple teeth to a full arch of teeth. We have lots of options. The downside with bridges is there's a pretty intensive lab fee with them, so they tend to be a little bit more expensive procedure. But they're very durable and they do stay in your mouth and they look and feel like your natural teeth. There's no taking out and putting in, it stays in your mouth. With that, there does become a little bit more effort on your end to clean it. And of course, anytime we do bridge work, we always go over with our patients and show them how to clean and maintain healthy gum tissue around the areas. So that brings us to our fourth treatment option, which is implants. So from the simplest implant treatment, which is basically a straightforward single implant, all the way up to multiple implants to replace multiple teeth, even all the way to lots of implants to replace all your teeth. Implants are a great option for getting you back to as close as you are before you lost the teeth. And it's a very straightforward process. The nice thing about dental implants is that we are basically just restoring that area. We don't have to touch the adjacent teeth. They can maintain the way they are. And an implant, single tooth implant, is one of the most highly successful things we do in dentistry. The biggest advantage of implants is that they're designed to last a lifetime. The process to get there, however, takes a while. I think some people have the conception that you can come in and get an implant in a tooth and be set in one appointment. That's probably the biggest drawback to implant therapy, is that there's a lot of planning and a lot of work on the front end, and also there's a lot of passive healing time. So even though it takes a while to go from placing the implant to getting your permanent tooth, the wait is worth it. So a lot of times we have patients that are missing all their teeth on the top or all their teeth on the bottom, or even both top and bottom teeth. And implants are a great solution we have to kind of upgrade you from dentures. So dentures are great. We do a lot of dentures and they look wonderful, they function, they give people the ability to chew and speak and enjoy in the world like they were before their teeth were gone. One thing I like to tell patients about dentures is that they are not a replacement for your teeth. Dentures are a solution for having no teeth. And one thing that's been really neat about technology and dental advancements is now we have the ability to use implants to upgrade and make your dentures more stable, more secure, and more functional. So if any of this is interesting to you, I've got a book coming out this fall that kind of goes into some of the really cool background of the dental world, and also the technologies and the new treatment options we have for everybody. Subscribe to our link, we'll get more updates on that later. I know it can be overwhelming. I went to school for 7 years to figure all this out, and here you are coming to see me and trying to figure out in 1 or 2 appointments. But that's why I'm here, and that's why every patient I want to sit down with and talk to them and make sure they understand their treatment is unique. And the most successful dental treatment is the one that answers your problems, but also that I feel confident is going to last you a lifetime. I'm Dr. Langston, and we're here to help you watch your mouth. I know a lot of this can be overwhelming, and before I dive into the next topic, subscribe to our channel to follow us for more information about dental implant treatment and other options you have for your mouth. Be sure to check out our next video here, which is all about what to expect in your dental implant treatment. Watch your mouth. I did that over Mike. Rock and rolling. Let's do it.